Enter the room.
Good evening. My name is Dr. Oluwakayode Komolafe. I'm one of the doctors in this GP surgery. Could you please tell me your full name and age?
Hi, doctor. I'm Sarah Harrison. I'm 45.
Thank you. How do you wish I call you for this consultation, please?
Sarah is fine.
Okay, thank you. Could you please tell me the exact reason why you want to see us this afternoon?
I've been feeling a little weak for the last 1 week.
Oh, sorry about that, Sarah. Could you please elaborate more on this weakness?
Yeah, it's like my arms and legs are not working. It feels like I can't really do anything. It's just been getting worse.
Oh, okay. So both arms and legs are weak.
Yeah, both. Like I can't even lift my arm to take something from the shelf, or I can't really brake when I'm trying to drive, or press the clutch when I'm trying to drive. It's
Okay.
being very.
I understand. I understand you. I understand you well. Apart from this weakness, do you feel any loss of sensation in your legs or arms?
No, I didn't really notice anything like that.
Okay. Okay. How has the condition over time? Has it become worse or better?
Yeah, it's definitely getting worse for the last 1 week.
Okay. 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 Apart from this weakness, do you also have like anything like shortness of breath or any other condition?
No, nothing. Right now, there's nothing.
Okay. Okay. Do you feel any dizziness?
No.
Okay. Okay. Thank you. I will need to ask you some questions about your general state of health.
Mm-hmm.
Recently, do you ever have any flu-like symptoms or fever?
Yeah, actually, now that you mention it, maybe like 3 weeks ago, I had like flu-like symptoms like sneezing, fever, and some sore throat.
Okay. Okay. And how are you feeling right now?
I'm good, except for this weakness. There's no other symptoms right now.
Okay. I understand you. Have you ever been diagnosed of any long-term condition like high blood pressure, diabetes, or joint problems?
No, no, doctor. I'm
Do you know
perfectly
whether you?
healthy.
Okay. Thank you. Do you know whether you have any allergy to any food or medications?
No, not that I know of.
Sarah, I would like to ask you some questions about which are very personal.
Yeah, sure.
Okay, thank you. Tell me about your menstrual flow. When did you see your menstrual period last?
Last was like 2 weeks ago.
Okay, okay. Is it regular?
Yeah, it is regular.
There is no any excessive bleeding?
No, not really.
Okay. Which method of contraceptives are you using?
No, I don't use anything.
Do you think you could be pregnant?
I doubt it, doctor. That'd be a miracle.
Okay. Have you done your pap and cervical smear? That is cervical
Um,
smear.
yeah, I've done I've been regularly getting it done.
Okay, okay, okay. This condition of weakness, you said it's affecting your work, is also affecting your daily activities?
Yeah, I mean, of course, I'm not even able to do any work around the house, and I can't drive also.
Okay. Do you smoke?
No,
Do you drink alcohol?
very rarely, maybe once a month.
Okay, thank you. I will need to quickly examine you, and this may include checking your blood pressure, heart rate, oxygen saturation, Then I will also need to examine your upper and lower limb. Is that comfortable with you? Then I will need to carry out certain blood investigation in order to rule out certain problems. I will need to do full blood counts to check the level of blood we have, check for ESR, serial markers of inflammations, check the function of your liver and kidney.
Okay.
Thank you, Sarah. I think from what we've discussed, you have a condition called Guillain-Barre syndrome.
Oh, what is that?
2 minutes remaining.
Yes. What it means is that the body is overreacting to the presence of certain things in your body and begin to attack your nerves. It is often follow past viral infections like what you have some weeks ago.
Okay.
Do you understand me? And because of this, we are going to urgently refer you to the hospital for expert management, because because if it is it could be a serious condition, it may proceed and affect the way you breathe.
Oh, doctor, that is it? That sounds very scary. Why did this happen?
Yeah, it's not scary. It's just the condition. We can never be certain about the severity, but to be on the safer side, then for now, it will be advisable for you not to drive because the weakness may affect your safety and compromise the safety of other road users. I'm going to give you a leaflet where you can read more about Guillain-Barre syndrome. I will also direct you to NHS website where you can read about it. Is that comfortable with you?
No, doctor. I'm a taxi driver. How can you tell me not to drive? That's my living.
No, you need to inform the DVLA, and we are going to contact the social workers who can be of help to you around this period. We can also contact your employer to give you sick leave. Then we can contact the council about benefit fund for you. Is that okay with you?
Okay, yeah.
Move on to the next station.
I noticed was so when I mentioned I can't drive, again you didn't show any empathy. Just like no, you need to inform the DVLA. Like just say something. Like, always try to say something before you you know, especially for things like these when the patient shows an emotion. Always try to say something empathetic. Yeah, I mean I can totally understand that, but I'm sorry, but you need to inform the DVLA. Right? Yeah, but other than that, it's fine. You've covered most of the things. But also when I said, oh, it's sounds very scary, and why did this happen? You didn't, you know, you didn't tell me why did this happen when I asked it. I know you mentioned it's because of viral infection, but I wanted to, I mean, basically, patient will ask you again sometimes, so you need to mention that again. You need to explain it again. But that's all right. And other than that, you mentioned that it's a serious condition. That's very good. And yeah, I think this is much better. You actually covered most of the things that are required. We'll just check the checklist and see if there's anything that's missing. But one thing that I realized is that you didn't know that she's a taxi driver till the end. So that's one thing. But in data
No,
gathering, why did you
we
go
discussed
into?
that in the talk. at the top, we discuss it, that is affecting your job as a taxi driver.
Okay, okay. Yeah, you asked me, is it affecting you, your work also? Yeah, yeah. I didn't mention taxi driver back then, but yeah, I just said I can't drive. One thing I wanted to ask, why did you go into menstrual history and you know, last menstrual period and all that?
Any woman that is
No, not really. I mean, you had, that's okay, but if you had enough time, you can. But it's not really relevant here, is it? Like, what? Always don't ask things unless you have something in mind. It's not that any woman. So here you have. It's a neurological issue that you realized. What
okay.
gynecological issue can cause neurological issue? There's nothing like that, right? So there's no point asking that. So
Okay.
instead, yeah, you would have had more time for management if you had just skipped that. And you went on asking, "Will you? Is there any chance you're pregnant?" I mean, did you even ask if I'm sexually active? Like, how can you know, she be pregnant whether without taking sexual history?
Okay.
So always try to keep a, you know, sequence of questions when you're questioning the patient. So whenever you're planning to ask something, always have a reason for why you're asking that. So is there a chance you're pregnant right now? What was your reasoning for asking that? Like, does pregnancy cause anything like this? No, right?
No,
So
you
that's
know,
also not needed.
I just asking routinely because if somebody is pregnant, it may affect the management. So that's why I
Mm.
just ask routinely.
Yeah, that's not that relevant. So you need to think about, so if when would you ask about pregnancy is if you think that there's something that is actually causing the condition, because you're not going to immediately give them something that is, you know, going to you know, be contraindicated for pregnancy. That is something that can be checked later also, like after, I mean, like after the consultation, when the treatment is actually going to be given, that time they can check. So it's not like it has to be done so urgently right now. So you always have to prioritize your questions, especially in data gathering. There's very less time you have. Don't waste it on these questions, right? But not bad. Like, yeah, that's the only thing that I noticed, that it just went somewhere else, the conversation after. So I'll just give you a small brief thing about how to take your data, you know, your data gathering. So you take your presenting complaint, history of presenting complaint, which is basically Socrates Odipara. After history of presenting complaint, you immediately you prima aftosa, you only ask the relevant things, and then you go into red flags and rule out the most different, most worst, like a worst differential you rule out, and then you move on. That's all. You don't need to ask everything in prima aftosa. You don't need to ask all the differentials. You just you only need to prioritize things like based on the relevancy of the case. All right. Finished. Yeah, let's check the checklist. Okay, so identifiers is very good. You asked everything. So systemic review. So there you never asked about fever. So you asked directly, did you have any flu-like symptoms before, recently? Instead of asking that, if you are just currently, what about fever? Fever is a very important, you know, associated symptom that you can ask. So if you had just asked me, do you have fever right now? I would have said, yeah, I had fever 2 weeks ago, but not right now. That would have been more natural, because this seems a little scripted if you directly go into the question of, oh, did you have, you know, fever, you know, recently? But yeah, that's fine. It's not that big of issue. But one thing is red flags. So you mentioned this in your safety netting, where you said it can affect your breathing and things like that. So that is something you should ask here itself. In your data gathering also, always try to rule out the red flags. All right. And ICE, ideas, consent, expectation, you didn't do this time. So instead of you're entirely taking time after that, try to keep the time for ICE. Ideas, consent, expectations are more important than actually menstrual history and pregnancy history in this case, right?
Okay.
Other than that, possible treatments, it's not that important, but yeah, that's something that you can talk about. Informed DVLA, that's very good that you spoke about. Consult with seniors. This is a case that the junior doctor alone can't treat. So always, and you can't be sure about it, that is GBS also. It needs to be confirmed as well, right? So may always try to involve seniors in complicated cases. So wherever you're admitting or referring, urgent referring, always try to mention the fact that you'll talk to the seniors also. That's very important. And leaflets you mentioned. This also I noticed that you just immediately mentioned leaflets before I could respond. So that's one thing. I think it just came as a as a reflex. It came to you that you had to mention leaflets that you mentioned. But that was one point where you interrupted me again. But that's okay.
Okay.
And yeah, otherwise everything else is fine.
Please like and subscribe to Turing Med School. Good luck with your preparation.